So, I'm very flattered that you would show the bad taste and come twice. My name is Dr. Michael Vaughn. My undergraduate degree is in engineering. I was an engineer for 3 years, then went to medical school. After medical school, I did my internship, and then I started a group called MedHelp, and I've been there for 37 years. I also have a drug research company called Cahaba Research, and so that gives me kind of another insight into these studies, because I've done, so far in the last 4 years, I think I counted up 90 different drug studies. Drug companies come to us and ask us to do studies for them on drugs that they're bringing to the market, okay? So I've got a list of all the studies that have been done under my company, and it's a long list. But my ability to be here today is I've got Parkinson's. And so when I was told I had Parkinson's, I immediately started researching things that I could do naturally without drugs that would help me with my Parkinson's. And so that's what I've done for the last year and a half. And I've accumulated a lot of stuff, and there's a lot of it that's a little complicated, but my goal here tonight is to encourage y'all to use some of these medications for your Parkinson's symptoms or your Parkinson's patients. Let's see here. A lot of the research that I've done have been used by a website called PubMed. I've got that in the handout that I gave you, but PubMed has 30 million and counting abstracts on anything to do with medicine. You know, if you want to know what rats do in Singapore, you can find it on PubMed. But PubMed is also free, and you don't have to have a medical degree to access it. But it does help to know medical terminology, because you can access this and it can get a little confusing. But I'd like to encourage y'all to use PubMed, and then get a medical dictionary or something next to you, and read the study, and then look up the words you don't know. But everything that I am going to tell you tonight is verified or comes off PubMed. And it is a nationally recognized database, so this is nothing unusual. In fact, it's unusual that y'all don't know about it, because a lot of lay people use it too. Okay? So, let's see here. Fun facts about Parkinson's disease, okay? If there are any fun facts. One of the things to prevent Parkinson's disease is to smoke. So smoking actually prevents or lowers your risk of Parkinson's disease. Wine, alcohol, tea, coffee, all prevent Parkinson's disease. My problem is I got to be 67 years old and never had a cup of coffee in my life. I hated coffee. My mother used to drink it all the time. I just didn't like it. And tea. I've never had a cup of tea in my life either. But tea and coffee have what we call polyphenols in it that help with Parkinson's.
Did you want to start?
Did I start drinking? Yes, ma'am. I drink a couple of cups of green tea a day. I take a green tea pill called ECGC. It'll be in that list that I gave you. And I also use chlorogenic acid, which is the active ingredient in coffee that helps with Parkinson's. So those are all on the list that I gave you. The older you are, and if you're male, the more risk you have for Parkinson's. And interestingly enough, agricultural pesticides seem to cause Parkinson's. And guess who was raised on a farm in Iowa? Me. So that kind of hit home. All right. What dopamine is what is lacking in Parkinson's disease, and all the medications that you are on prescription, their main goal is to increase the amount of dopamine in your brain. But there's other ways to increase dopamine in your brain other than just prescription medications, and we're going to go over some of those tonight. Let's see. Okay. There are some no-brainers that I call just, you should really know about these and do these. Let's talk about hypertension for a minute. How many of y'all are being treated for hypertension? Take medication. It's very, very common in people with Parkinson's, okay? There is a antihypertensive medication group called the ARBs. They've been around a long time. Angiotensin receptor blockers. Don't worry about the name. Anyway, that group of medications has been shown to have a beneficial effect on Parkinson's, and it changes the way your body looks at hypertension. So the bottom line is, here's a medication group of medications called ARBs that are well accepted by the medical community and used for hypertension all the time. But they also inhibit a lot of the bad things that Parkinson's does to you. And so the question is, my mind, why doesn't every doctor who has a Parkinson's patient give them an ARB? And it's just because they really don't know about it. It's not published. In PubMed it's published, but it's a no-brainer. If you've got hypertension, you want to take an ARB. Under that group of medications that I gave you, it would be called telmisartan. And this medicine is very clean. The doctors in the group will tell you it's very clean, no side effects, it's inexpensive, okay? So if you got hypertension, take it, all right? I mean, just unequivocally take it. I don't have hypertension. My blood pressure's always been excellent. Guess who takes a telmisartan every day? I do. Here's the abstract, the title of an abstract about ARBs. Angiotensin type 1 receptor antagonists protect against alpha-synuclein death. Alpha-synuclein is a bad protein that Parkinson's encourages. We're not really sure how it works, but it grows in your brain, in your cells, alpha-synuclein. So anything you can do to decrease alpha-synuclein is worth doing. This is something that I would highly, highly recommend to start on if you have hypertension. Ask your physician. They shouldn't mind, because telmisartan ARBs are just as good at treating hypertension as anything else. And so it's generic, it doesn't cost anything. Ask your physician to switch you over to an ARB. Specifically, I like telmisartan the best. And that's on that list that I gave you there. Okay. How many people have high cholesterol? Okay, and you're getting treated for high cholesterol. There are two types. It's called the blood-brain barrier. Some medicines can get through to the brain, others can't. If you're taking a Parkinson's medicine, you better make sure that it crosses the blood-brain barrier, because if it doesn't, it has absolutely no effect on Parkinson's, because it doesn't get to your brain. There are two medications, simvastatin, these are cholesterol medications, simvastatin and atorvastatin, that are lipophilic. They're cross the blood-brain barrier. If you're on one of those medications, stay on it, because they're inexpensive, well-proven, and they probably help with Parkinson's. If you're on Crestor or Pravachol, switch over to simvastatin or atorvastatin, because Crestor and Pravachol don't cross the blood-brain barrier. So you've got some statin, cholesterol medicines that cross the blood-brain barrier and some that don't. You always want to make sure that the medicine you're on crosses the blood-brain barrier. So those two drugs that you can use for cholesterol are simvastatin and atorvastatin. Again, generic, widely available, very few side effects, and your physician should be very comfortable in switching you from Crestor over to atorvastatin. Shouldn't be a big deal at all, because they're both generic. Okay, so any questions about that? Those are things your physician can do. Yes?
Spell that last one that you're saying.
Simvastatin or Pravachol.
The torvastatin?
Atorvastatin, also known as Lipitor.
Okay.
Atorsta.
Okay, yeah, I know.
Atorvastatin.
What's the benefit there with the blood-brain barrier and your Parkinson's?
Well, the benefit is if they don't go through the blood-brain barrier, they don't get to your brain. If they don't get to your brain, they can't help your Parkinson's. Did I answer that question?
I think.
What do they do to help the Parkinson's?
Yeah.
Oh, they help with inflammation
Okay.
mainly, but there's other things too. I really ought to go back for a second. Parkinson's is thought to be a multifactorial disease. In other words, more than one cause. Well, that makes it really difficult for physicians because it'd be so great to say, okay, we got one cause, we got one medicine, that's the end of it, But Parkinson has at least 3 different causes. Mitochondrial dysfunction, which, well, I won't, there's no sense in me going over the 3 causes because you won't understand anyway. But the bottom line is, it's a multifactorial disease, and so it may take multi-drugs to get rid of the multifactorial disease. And so, but what I'm looking for when I see a drug study on Parkinson's, I look and see if it addresses one of the 3 causes of Parkinson's. So if it causes inflammation, Parkinson causes inflammation. If there's a Parkinson drug that helps with inflammation, I'm on it, okay, because I want to see if it'll work. Then there's another cause called mitochondrial dysfunction. And so that's 2 causes. If I can find a drug, Parkinson's drug, that gets 2 causes of Parkinson's, I'm really in high cotton. And 3 is called reactive oxygen or free radicals. So if I can find a medication that addresses all 3 of those problems with Parkinson's, I'm really going to be very interested in that drug to take and recommend to other people.
What is the last one you gave?
Mitochondrial dysfunction, free radicals.
Yeah.
I'm a child of the 60s. I used to say free radicals anyway, but that's a different story.
When you say inflammation, what particular kind of inflammation are you talking about?
The body's immune system is trying to kill whatever they're being directed toward to kill, and it causes the body's immune system usually uses inflammation to kill whatever it's trying to kill.
Right.
So the inflammation, actually go back to a medical student lecture, inflammation is the final common pathway to aging, okay? Inflammation has caused diabetes, inflammation causes atherosclerosis, inflammation causes Alzheimer's, inflammation causes Parkinson's disease. So inflammation is kind of, as you get older, your inflammation goes up in your body.
Each of those areas has inflammation? Is
Yeah,
that what happens?
yeah. And so you want to address inflammation. And that's where like the fish oil comes in, exercise, we're going to talk about some of those things. But, all right, so go back to the statin. We got off a little bit of track. On cholesterol, you want a statin, a cholesterol medication that crosses the blood-brain barrier. That is not Crestor, that is not Pravachol, that is atorvastatin, that is simvastatin. Again, generic, cheap, been around a long time. Physicians should not care if you switch from Crestor to Lipitor or atorvastatin.
So Dr. Vaughn, you take this, you don't have any kind of you don't have any issue with...
My cholesterol's always been perfect.
Right, okay.
I take it every day.
So this is like a prophylactic?
Prophylactic because it's anti-inflammatory.
So a doctor would say, yeah, we'll put you on that.
If they're open-minded, they will.
Okay. Can we come to you?
I have a new physician in our group over here. You could come see her. Dr. Moore, would you stand up? I wasn't aware she was coming tonight, but she's one of my trainees from medical school many years ago, and now she's joined our group, and I'm so happy to have her. She's fantastic. But most physicians, if you tell them, look, I'm on atorvastatin and I want simvastatin, they shouldn't give you a hard time. I mean, they really shouldn't. Hmm?
If you're not on any.
Well, if you're not on anything, they're going to raise their eyebrows. Why are you taking this medication when you don't have high cholesterol? And the answer would be because cholesterol causes inflammation, and I want to lower my levels of inflammation. Okay.
Vaughn,
Hmm?
could I ask, going back to the blood pressure
Yeah.
medicine, is the blood pressure gonna bottom out if you have?
Good
if you
question.
have a normal?
Telmisartan, that particular class of medication, the ARB, doesn't really lower your blood pressure too much if you don't have high blood pressure. And I know that sounds really funky, but my blood pressure really hasn't changed at all since I've been on telmisartan. And like I said, I don't have high blood pressure.
No,
Okay.
one question.
Yeah.
What's your blood pressure?
What's my blood pressure? You don't want to know, it'll just depress you. 90/60 is what mine has been for the last 67 years.
That's our target.
Amazing.
What?
That's our target. That is our target.
Oh, no, that's too low. You got to be used to that.
120.
Now, your target, 120/80, would be fine. Now, if you can get it lower, but the data's not there as far as, mine's 90/60 without me doing anything. You know, I'm not doing something actively to get it down to 90/60. It was 90/60 before I started the telmisartan. Does that make sense? Okay. So, medicine and lipophilic. Okay. Depression. Depression is very common in Parkinson's disease. I get depressed when I look in the mirror. It was my first symptom of Parkinson's. Okay, I got depressed, and I don't ever get depressed. My daughter will tell you, depression is not my thing. But I started getting depressed, and it turned out it was Parkinson's that was causing my depression. Depression is a real problem. It affects your sleep, it affects anxiety, it affects your fatigue. It's a big deal. And how many of y'all are on antidepressant? Okay. That's probably not a bad call by your physician to be on an antidepressant. And most of the common most common most common antidepressants are from a class called the SSRI. Example antidepressants are Prozac. Have you ever heard of Prozac? Paxil, Celexa, Lexapro. Those are all in the same class, and they're good antidepressants, and they have few side effects, which is really a nice thing. However, they don't seem to do anything for Parkinson's. There's nothing wrong with taking them, but if I was going to take a medication, I'm looking for a twofer. I'm looking for something that would help my depression and help my Parkinson's, okay? Well, there's a medicine called nortriptyline, also known as Pamelor. It's on that list too. And there are studies that show that nortriptyline and Pamelor actually help with Parkinson's. There's tell me when I'm getting into the weeds, okay? But there's a process that happens when you have Parkinson's where you have proteins that fold, and a protein has to fold in the right direction or it's no good, or even it can hurt you. And Parkinson's is known for having these folded proteins that are no good. So nortriptyline is, here's the title of the article. Nortriptyline inhibits aggregation and neurotoxicity of alpha-synuclein, there's alpha-synuclein again, by enhancing reconfiguration of the monomeric form. Translated into English, what that means is it helps your proteins fold in the right way. That's a big deal, okay? You want your alpha-synuclein out of there or folded in the right way. So why not take an antidepressant that helps with depression, helps with your sleep, and helps prevent the folding of this protein? See, that's what I'm trying to do when I go through the literature is can I get a 2 for this, or can I get a 3 for this? You understand what I'm saying? So with nortriptyline, I'm on nortriptyline. It helps with your sleep. It's a great sleep medication. It's a good antidepressant. It's been around 40 years. You can probably get Pamelor a month's worth for $5. Okay, I mean, it doesn't cost anything. Very few side effects. And you should be on it for your depression. Not the Paxil, well, I didn't say that. You want to look at your Prozac and Paxil and Celexa and things and see if maybe your physician would take you off those and put you on the nortriptyline, okay?
Which, the nortriptyline?
Nortriptyline is, the problem with being well, there's a lot of problems with being a doctor. But one of the problems with being a doctor is every medication has 2 names. So nortriptyline is the generic name, Pamelor is the trade name. You know, it's hard enough being a doctor without having to learn 2 medications for 2 names for every medication. But anyway, and here's another article. Nortriptyline delays disease onset in models of chronic neurodegeneration. Oh,
I just wondered where Xanax fell in the antidepressant.
it's not an antidepressant, it's an anti-anxiety.
Okay.
I'd be very careful with Xanax because it can be addicting. So be very careful with Xanax.
Be careful with what, nortriptyline?
No, it's not addicting, but the Xanax she asked me about is addicting. Okay, so anyway, here's another study that shows that nortriptyline or Pamelor helps you with Parkinson's. It actually delays the disease onset in Parkinson's disease. So that's incredible. That's incredible. So there is a little question on nortriptyline if you're on Azilect or Selegiline. And there may be an interaction there. I've never seen it, and I can't find any incidences of it in the literature. So in other words, I have no record of it ever happening to anybody, but theoretically, there's a interaction between Rosalagine and the nortriptyline. But I take it and it's perfectly fine. If there's just, literally, there's no, theoretically, it can be an interaction, but there's no record of it ever happening. So I'm not going to worry about it. Okay.
I have a question.
Mm-hmm.
You said it's an SSRI, right? Would you happen to know if Effexor is an SSRI as well?
SSRI is, Effexor is a, not an SSRI, but what is a, Dr. Moore? What class is Effexor in?
That's a good question. Now you're putting me on the spot. Effexor is very good as an anxiolytic, for anxiety and depression, but I think it's more of a SNRI.
That's what I was looking for, SNRI. It's a SNRI instead of an SSRI.
What's that? What's the difference?
Oh, man. They're just different classes of medication. They're both used for depression, but they are different in how they work a little bit. And that's, you know, I get into the weeds real easy on that one. So, but the bottom line is, look at what you're on as far as antidepressant and see if they'll consider Pamelor or nortriptyline. Helps with your sleep, helps with depression, and helps calm down the disease in your brain from Parkinson's. Okay? Yeah.
Where does Celexa fit in?
It's an SSRI. Nothing wrong with them. It's just that if I'm going to take a medication for depression, if I can find one that also helps with Parkinson's, I'm all over it. Okay? All right. Now, my current, Ed will tell you sometimes I get on tangents. This is not a tangent, Ed, but I've been on him the last month or so about melatonin. And there's some exciting stuff coming out about melatonin. We mentioned melatonin back in November, but I didn't emphasize it as enough as I'm going to now, because literally, that's amazing how medicine works now. There was an article on melatonin published last week that has come and really reinforce my melatonin liking. And so let's talk about melatonin for a second. Melatonin helps you sleep. That's a big deal. People with Parkinson's have trouble sleeping. Melatonin really helps with that. Here are a couple of articles, and listen carefully. Melatonin, clinical perspectives in neurodegeneration. Prevention of neurodegenerative diseases is presently a major goal for our society, and melatonin, an unusual phylogenetically conserved molecule present in all aerobic aneurysms, merits consideration in this respect. Let's go down to, okay. As a cytoprotective molecule, cyto means cell. So as a cell-protecting molecule, that's pretty important. We want to protect our brain cells, right? As a cytoprotective molecule, melatonin reverses the low degree of inflammatory damage seen in neurodegenerative disorders and aging. Consider this next statement. Low levels of melatonin in blood characterize advancing age. As you get older, your melatonin levels go down. In experimental models of Alzheimer's disease and Parkinson's disease, the neurodegeneration observed is prevented by melatonin. That's a hell of a statement right there. That really is. Melatonin also increased removal of toxic proteins by the brain lymphatic system. Really cool. We now know that the brain has a lymphatic system just like the rest of your body does. And at night when you go to sleep, especially in REM sleep, your brain literally cleans itself. There's liquid that comes out and it pulls up all the toxic proteins and all the funky stuff that's happened to the brain and gets rid of it. That's new. We didn't know that. I mean, that's probably within the last year we figured out the brain has a lymphatic system. But anything that promotes that is good because it helps clean your brain out for the next day. Well, guess what? Melatonin increased removal of toxic proteins by the brain lymphatic system. So I'm pushing melatonin now. Of course, I own a melatonin factory too. What were you gonna?
But melatonin is just an evening kind of a thing. People don't take that during the day, do they?
There's some specialized diseases that I don't know about that use melatonin during the day, but no, melatonin is used for sleep. Mm-hmm. About 30 minutes before you want to go to bed, you want to take your melatonin.
What quantity?
Well, 3, 4, 5, but now with this new article out, this guy said 40 to 100 milligrams is what should, in fact, let's see. A limited number of clinical trials endorse melatonin's potentiality in Alzheimer's and Parkinson's, particularly in the early stage of the disease. Calculations derived from animal studies indicate cytoprotective melatonin doses in the 40 to 100 milligram range. That's brand new. You know, if you'd have told me, 3 months ago that I'd be, guess who's taking 40 milligrams of melatonin every day? I am.
That's a lot. How many pills is that? Because on the ones I have, it looked like I would
It's
have
really
to
tough
take
to
a
find
bunch of
because
them.
it's not prescribed, bought that much. But you can buy 20 milligram capsules and you can buy 60 milligram capsules. They're a little hard to find. Get on the internet, you can find them. But it does not require prescription at all.
You can get it at Sam's Club. Well, I'm just telling you, it's 10 milligrams, they have it at Sam's. 10 milligrams, you can find it there. I don't think they have 20. I take 4 a night. I take 40 like Dr.
You're taking a
Right.
time release dope, say at night, when you go to sleep. Is that-
The time release really don't make that much difference. There was a study done on that. So regular melatonin will do just as well as time release.
If you were already taking a sedative, would you do melatonin in addition to?
Is very safe medication. Melatonin is almost impossible to hurt yourself with. So yeah, it wouldn't bother me.
If you're already taking Klonopin or?
Yeah, but what I try to do is I try to wean off the Klonopin, which is helping you sleep, and get on the melatonin. Klonopin causes you to sleep in a different way than melatonin does. And melatonin has got so many great benefits that I wouldn't use the Klonopin for sleep anymore. I try to wean off that. I'm not sure you can come off. You have to wean yourself off. But anyway,
One more question about melatonin.
yeah.
Has there been further research about screen time and melatonin production?
You mean as far as blue light from a computer?
Correct, yeah.
It's pretty well established that blue light from a computer 2 hours before you go to bed is not good. So you want to cut down on blue light for the last 2 hours before you go to bed.
So does that include smartphones and TVs as well?
I don't know the answer to that. I know it's been done on big computer screens. I don't know if it was small little. Of course, how many teenage girls would commit suicide if they couldn't? Anyway, couldn't read their phones at night. But I don't know about little screens. I really don't. But you want to try to avoid bright light. But melatonin is, I think, going to become one of the cornerstones of Parkinson's disease treatment. Now, why aren't all these done? Why aren't they all proven? And it's because nobody can patent melatonin. Okay? If you spend $1 million proving that melatonin helped with depression, well, guess what? Your competitor, when you publish that study, they'll make the melatonin and capitalize off that test. It's not that they're greedy, it's just that I'm not going to spend time trying to certify melatonin as being the best thing since sliced bread because I can't make any money doing that. Does that make sense? That's why so many manufacturers, what they'll do is they'll take a substance like melatonin and add a little chemical thing to the molecule, and then they can patent it. But so far, nobody's been able to patent melatonin. So what I'm saying is, if you wonder why all these things you haven't heard of or why your doctor doesn't do them, it's because there's no money in it. And I wish I could change that, but all they do is do these studies, and then they say further studies need to be done, but nobody's going to do them. Does that make sense?
Is it a synthetic?
Yeah, it's a manufactured. Melatonin is a manufactured chemical. All right. Let's see here. Okay. So melatonin. If you don't get anything else from this lecture today, I'm thinking that melatonin would be one of your more important takeaways. Yeah.
Is there a certain brand that you would recommend?
No, if you can find, I like Life Extension Foundation. They're pretty good. They're very reputable. I like VitaCost. I've got it on the list that I gave you of medications. Some of them that are a little harder to find in paragraph next to it, I gave you the company that you can get it from. All right. So, any questions about melatonin? Yeah.
At this point, you're looking at like melatonin to help the symptoms, correct?
Well, actually, to slow down the progression of the disease would be ideal. And anything that melatonin actually has, from this article, melatonin may be able to slow down the progression of the disease, which is huge. Even there's no medication on the market yet. Maybe the MAOB, like Rosaline and Roselagine and Selagine, they may help with disease modification, but it's very questionable. And then exercise may help with disease modification, but everything else that's been studied doesn't seem to slow down much the Parkinson's disease. That's the downer. That's why that's why I'm looking. I want to slow down on me. Yeah, Paul.
I was taking 10 of melatonin occasionally and slept about half the night, but since the November meeting, I've taken 40 every night and I sleep through the night most nights.
And you feel good in the morning, don't you? Yeah.
So I don't know about progression, but sleep is certainly.
Sleep is a big deal. Sleep is a big deal. All right. So, yeah. Oh, I'm sorry.
Is it possible that you could take too much?
I looked in the literature. I could not find an incidence of overdose on melatonin. So, I guess theoretically it's possible, but it's not in the literature, which is good. There's always somebody crazy out there who's going to take a whole bottle of melatonin. And so far, it hasn't been reported in the literature. So it's a very safe medication, very safe. That's one of the reasons I'm pushing it, because not only is it very efficacious, it's safe. You could take the whole bottle of melatonin, it shouldn't hurt you. You might not be awake for 2 days, but yeah.
Could you just verify one fundamental thing about Parkinson's, and that is the substantia nigra produce dopamine, the cells of the substantia nigra.
Right.
And they're dying off.
Right.
And that's essentially it.
That's what's happening in Parkinson's.
Okay.
Mm-hmm.
Clarify.
I've got actually a study. We'll talk about that in a second, but that's actually the title of a study I'm going to quote. Okay, now let's talk about the best thing for Parkinson's. Absolutely best thing for Parkinson's, best thing for Alzheimer's, best thing for your heart, best thing for your skin tone, best thing for your hair. What am I talking about? It's free. Exercise is what I'm talking about. And exercise is almost a miracle drug for Parkinson's, okay? And it costs nothing, no side effects except you look good. It prevents a whole lot of different diseases, and it works. And so to your question, let's see here. I should have it. Oh yeah, I know where it is. High intensity exercise acutely increases substantia nigra and prefrontal brain activity in Parkinson's disease. Translated into English, when you exercise, good things happen in the disease portion of your brain when you have Parkinson's. Guess where this study was done? UAB Center for Exercise Medicine, the Department of Neurology, University of Alabama at Birmingham, Department of Physical Therapy, Samford University. This study was done right here in Birmingham. High intensity exercise, and the title almost says it all, acutely increases substantia nigra and prefrontal brain activity in Parkinson's disease. In other words, they exercised you, then they did x-rays, MRIs, et cetera, on your brain, and found out that it helped. That the areas of the brain that are deficient in Parkinson's light up when they test them after they've done exercise.
How much?
How much exercise? Now comes the depressing part. Okay. Before we get on to that, conclusions. Given the role of the substantia nigra and prefrontal cortex in motor and non-motor symptoms in Parkinson's disease, the acute increases in brain activity within these regions, if repeated frequently over time, may serve as potential mechanism underlying exercise-induced Parkinson's disease specific clinical benefits. Bottom line is exercise. Okay?
Mike, I was in that study. I was in that study.
Were you in that study?
I was number 1. Yeah.
Cool.
Yeah, in fact, I'm still going back every year for cognitive assessment.
Yeah, UAB's got a good school of medicine. It's well known. It's well known. I'm one of their graduates they're not that proud of. But anyway. All right. Now let's talk about the bad part. There's, if it's too good to be true, it's usually too good to be true. There are several articles in the literature that show that voluntary exercise does not work. Okay? Only forced exercise worked. Okay? And there's lots of studies on that. Now, what's the difference between voluntary exercise and forced exercise? Okay? There's lots of different ways we can approach this. One is, the study was done on a tandem bike. Okay, did y'all hear, did I give you the tandem bike story last year? Okay. The guy for Parkinson's at Cleveland Clinic was on a tandem bike ride with a Parkinson's patient from Cleveland Clinic, and they were driving across Iowa. I'm from Iowa, so it's one of the reasons I know the story. And at that time, you know what they did for Parkinson's patients? They put him to bed. They put him to bed. The absolute worst thing you can do for a Parkinson's patient, and they did it. That was standard of treatment. Well, this guy was on a tandem bike with the Parkinson's patient, and he's the neurologist. And you know, in a tandem bike, guess what? You have to pedal at the same force and the same rhythm as the guy in front of you, right? I mean, you are forced, I'm using that word deliberately, you are forced to exercise, okay? Well, he noticed the first day they get off the bike, and she says, my Parkinson's better. You're what? I said, yeah. Well, look at this. I was writing a letter to my husband, and my Parkinson's writing is gone. I'm writing normal again. Haven't done that for years. He said, that's interesting. Next day, they do another bike, and at the end of the bike thing at that night, she says, I feel better. And my symptoms of Parkinson's are so much better. He went back, did a study at Cleveland Clinic, and it was the first study that showed that exercise, forced exercise, helped with Parkinson's. Changed the way we treat Parkinson's. This guy's a smart guy, okay? But forced exercise is a tandem bike. Also, when I'm doing gym, I do the boxing thing with Martin. And by the way, anybody who doesn't know Martin or use Martin, he's exceptional. He is an asset. I love the guy to death. Don't tell him that. In fact, I'll tell you this story, Juliana. I apologize. He gives everybody nicknames, right? Okay. I come home one night. I'm all excited. The whole family's there. And I say, you know, Martin gave me my nickname today. They said, what is it? I said, Magic Mike. And all my family started going, oh no, you can't. I said, what? Magic Mike? I kind of like it. They said, there's a video that you're too young to watch that says Magic Mike is a male stripper. You think I'm joking? I'd love to make this up. But anyway, so my name at the gym is Magic Mike, and my wife still hadn't let me look at the video.
Terrible test here.
Terrible test. Isn't he cool with his nickname? But my family does not like him for that reason. But anyway, and I'm going to keep it, Juliana. Okay, so forced exercise. When I'm doing the gym today at boxing, I'm forcing myself. I'm hurting, okay? Well, I go ahead and don't stop when I hurt. I just try to press on as hard as I can. I'm forcing myself to do it, even though my thighs are screaming stop, okay? Like if we'll get in a line and we're getting ready to box, okay? I'm in the line doing this while we're boxing, okay? Because I want that extra exertion because I want the forced exercise. Another way you can determine whether you're getting forced exercise is to calculate your maximum heart rate. And there's a way to do that. 220 minus your age is equal to your maximum heart rate. Okay? So I'm 7, let's assume I'm 70. 220 from 70 is 150. And so that's my maximum heart rate. Okay? You want to do about 85% of your maximum heart rate. So you would multiply that by 0.85. Have I lost y'all? Okay. So my maximum heart rate is 130. That's my calculation for me. So that's the beats I'm looking for, and that's forced exercise. But there are too many studies here. I tried to get out of it. I said, crap. You know, there's no such thing as a free lunch. So voluntary, let me see here. Oh, we got some interesting stuff to talk about too. Do you like marijuana? Okay.
Try it once, it's in hell.
Okay. Well, anyway, I can't find the article, but the one from UAB, okay? When they saw this, it was high intensity exercise. Notice they didn't say exercise. Notice they said high-intensity exercise, okay? So you've got, yes, exercise is good, but there's too much data in the literature that says that forced exercise is what really worked. And the kind of funky thing is, some of these studies, they would force exercise them for a month, and then they didn't do any exercise for a month, and guess what? At the end of the second month, they were still way ahead of people who'd never done it at all. So you're just gonna have to do exercise. There's just no other way around it. I mean, and if you do exercise, just visualize me and say, that's my goal. Okay. Took a while, but they got it. Okay. Here's a study I was looking for. Forced, not voluntary exercise improves motor function in Parkinson's disease patients. There's the title right there. I hate it, but that's novel high-intensity exercise prescription improves muscle mass, mitochondrial function, and physical capacity in individuals with Parkinson's disease. So they're just saying it's got to be forced. So, hey gang, we got, it's not easy where we're at, but
Mike, what's the proper recommended amount of exercise?
85% of your maximum heart rate.
For how long? For sustain.
As long as you can sustain it.
No, I guess my question was, how many days a week?
I do every day but Sunday. I literally do. I don't care what I got on my schedule, and I'm a fairly busy guy with 6 kids and a couple of businesses, but I do every day except Sunday. Sunday I rest. If God can rest after.
We do an hour and 15 minutes 3 times a week. I feel like I'm.
That's probably good. You're probably doing all you need to do. I'm just, as you can tell, a little over cautious. So I'm gonna take 20 minutes and go listen to a podcast and really push. Oh, by the way, I've got a book. I think it should be in there. Dr. Wenzel, prescription, workout prescription. I highly recommend that book. It's like $12 off of Amazon. Okay. Oh, but here's the really funky part. I'm talking about the brain. High-intensity aerobic exercise acutely increases brain-derived neurotrophic factor. That's called BDNF in medical terms. And this is incredible. I was taught in medical school that the brain which you're born with doesn't change, is not plastic, does not grow new connections. Once you get to be an adult, your brain is what you got and it doesn't change. That is not true. We now know that your brain is making new connections all the time, that your brain is wiring new pathways all the time, that your brain is cleaning itself and repairing the damage all the time. It's amazing what we didn't know, okay? What this article said, and there's been many that show that brain-derived neurotrophic factor is the repair glue that can repair your Parkinson's. Okay, now that's heavy. That's a heavy statement.
Cleaning your brain.
It's called the glymphatic system.
Draining at night, everything.
Absolutely. REM sleep helps clean your brain. Isn't that interesting?
REM sleep helps.
REM,
REM sleep.
rapid eye movement sleep.
Yeah, but does what now?
Cleans your brain.
Can help clean your brain.
Cleans your brain.
Mm-hmm. So there's good data in the literature that shows that brain-derived neurotrophic factor is increased in your brain when you exercise. And brain-derived neurotrophic factor is the chemical that helps your brain do new connections and repair damage. That is awesome.
Is it all tied to increasing your heart rate? If you're working out with weights or something, does that not help?
If you're doing your maximum, the best way, my fallback position would be do 85% of your maximum heart rate. And that's the way you'll know that you're doing it. I force myself, I just start hurting.
Well, I know when I'm on a bike, I can monitor that, but if I'm just working out with weights or doing different leg exercises.
Or buy yourself a Fitbit, so you'll know what your heart rate is. But I can't emphasize to you enough, you get listen to what I'm gonna say. You get new brain cells when you exercise. That's unbelievable. And 10 years ago, I would have called you a liar because it wasn't taught 10 years. We didn't know it 10 years ago. But we've got something that potentially can help with Parkinson's very greatly. And that's when you force yourself to exercise, you can do this growth factor called brain-derived neurotrophic. Neurotrophic means nerve growth. So brain-derived nerve growth factor. So that if another takeaway, exercise and hurt yourself exercising.
Do you wear a monitor when you exercise to tell that?
I usually don't because I know what 130 a minute.
I had something to that. We did the workout studies at UAB. We were monitored. And we wore a heart monitor every time we stepped on the workout floor. So their basis on what the artist was telling you is that they're basing it up on medical facts.
So in other words, if I'm taking a walk and I walk slowly, so I never really get my heartbeat up, I'm wasting my time.
Oh yeah, I'm way over time. I'm told. So if you're taking a walk, you're wasting your time.
Well, if I can't get my heart rate up because I can't walk that fast, is that any benefit?
I think exercise benefits, but as far as brain benefits, the data is not there. The data is, in fact, there's an article in here that I won't go over, but they compared forced exercise to voluntary exercise. There was a 35% decrease in Parkinson's symptoms in the forced exercise group. There was no change in the voluntary exercise group.
What is voluntary exercise?
Voluntary just means you don't push yourself. You know, does that make sense?
Like who's calling the shots? I mean, are you going at your own pace, or is somebody like Martin structuring the program that would make you do more than you might otherwise do?
I must have missed part of your question.
So who's calling the shots? I mean, are you directing yourself at your own pace,
Mhm.
or is someone else directing you?
Well, Martin's doing it when you're in the gym, right? And he's doing high intensity. Okay, he's right on it. Okay.
I was just gonna say, just for the sake of time, if y'all don't mind, I know we've got a lot of good questions, because we've got so much good information. If we could just hold our questions until the end, maybe Mike can stay after and answer questions,
Yeah,
so he could get through the presentation, if that's okay with everybody.
And if I'm keeping somebody
Because it's 6:30
late-
already, and I've told a lot of people, when they ask about the meeting time, I tell them we're out of here by 6:30, and I don't wanna discourage them by going too long. So if we could just hold our questions to the end, that would be great. And Mike will be, I'm sure he'll be glad to answer anything.
Yeah, sure, I
Thank
will.
you.
You're saying Martin's
Well,
a
you gotta-
scientist that's years ahead of time.
What Martin's doing in the gym is high intensity interval training.
Way ahead of
And that's-
everybody else.
I would recommend for your exercise high intensity interval training. That's Dr. Metzel's book. But all that is you can, the perfect illustration is if you're walking along and then you jog, get your heart rate up, then you walk a little bit, then you jog, you get your heart rate up. And that's high intensity interval training. So it describes exactly what you're doing. And that's what I do at home too. I do high intensity interval training. That's why I'm in superb physical condition. Okay. But actually you can get new brain cells from forced exercise. At least that's what we think. That's awesome. That's awesome. All right, a couple more, we'll go quick. Tetracycline, minocycline. It's a tetracycline antibiotic. There's some new studies that show that tetracycline antibiotics may help with Parkinson's, and minocycline especially. So I'm added that onto your list. Minocycline is very safe, okay? It's used by millions of teenage girls every day for acne, okay? It's inexpensive, and it has a lot of things to do with Parkinson's. I was very surprised when I did the research. So look at you might want to do PubMed and do minocycline and see what you get, minocycline Parkinson's. But I'm based on that, since I've talked to you in November, based on that, I'm taking a minocycline every day. Of course, the nice thing about me is I can write my own prescriptions. You know, I know y'all don't have that privilege, but I do. Especially I like writing myself the narcotic prescription. But that's a different subject. Okay. Let's talk about illegal stuff, okay, first of all. How about CBD? How many of y'all have used CBD oil or bought it, whatever? Okay. I'm going to be Debbie Downer on CBD. The need for more information about its potential benefits and side effects. Consumer demand for cannabidiol, CBD oil, has increased with growing sales from dispensaries because of the alleged medicinal benefits. Although studies examining the specific therapeutic effects of CBD are increasing, clinical data do not support the popular uses of CBD. And the first condition they list is for Parkinson's disease, schizophrenia, cancer palliation, treatment, chronic pain, spasticity, depression, anxiety disorder, insomnia, or inflammation. In other words, we have no good studies that show that it works for any of that stuff. Now, if it helps you, great. It's safe. It's not dangerous. It's very expensive. If you use the milligrams that are used in the studies, like some studies for anxiety have used 300 milligrams of CBD oil a day. Well, that was $30 of CBD oil per day. It's going to cost you, okay? But the bottom line is, I mean, I'll give you an illustration. There's some people that say that CBD oil helps with cancer. Well, you know what they base that on? One guy in London, England, who had lung cancer, who decided to use CBD oil, and his cancer went away, okay? So now CBD cures cancer. Well, that was one guy. Lord knows, you know, there's no validity there. So if you want to buy CBD oil, great. I don't have any problem with it, but there's no data other than it's placebo. All right, now let's talk about something that really works. How many of you smoked a joint? Never mind. Okay. Marijuana. If you do the studies on marijuana, marijuana is very effective for Parkinson's. It helps the motor symptoms and it helps the non-motor symptoms. You know what motor symptoms are and non-motor. Motor symptoms are like slow muscle movements, repetitive muscle movements, my shaking of my right hand. Those are motor symptoms of Parkinson's. Non-motor symptoms are depression, anxiety, insomnia, whatever. Marijuana is really a good substance. I mean, I hate to say this, but marijuana is very good treatment for Parkinson's. If it wasn't illegal, I would, never mind. But it's very effective, and it's been shown in many, many studies to help. I happen to be a libertarian. I don't think the government ought to tell me what I do with my body, okay? So I have no philosophical problems with marijuana. I probably have some medical problems with it. If, as a physician, if I was caught with marijuana in my bloodstream, that might be a problem. But marijuana is very safe and fairly effective. And yes, there's a small degree of dependence. About 10% of the people who use marijuana get addicted to it. But that 90% of those people don't get addicted to it, and it's very effective in marijuana, Parkinson's. And I can show you the studies. I won't read you the studies, but bottom line is, well, I don't know what the bottom line is on that.
Move to Colorado.
I don't want to, you know, when you get arrested, I don't want you to say, well, Dr. Vaughn said that I should be using marijuana and it's his fault. Magic Mike. There you go. Oh, goodness gracious. I'm never going to live that down. Okay. Yeah.
Are there any good studies on that?
Hmm?
Have there been any good studies when it comes to marijuana?
Yes. Many good studies when it comes to marijuana. I mean, it's very easy to correlate that. And let's see here. Pros and cons, okay. Smoking marijuana resulted in improvement of motor symptoms such as bradykinesia, resting tremor, rigidity, and posture, along with non-motor symptoms such as sleep and pain. Marijuana not only improves motor and non-motor activities, but has neuroprotective. I always love to see that when I'm researching Parkinson's. Neuroprotective means it protects your nerves, your brain. But also has neuroprotective properties and helps in improving symptoms of Parkinson's disease, as well as, this is a big statement, as well as delaying its progression. I'm not sure I believe that, but there's some studies have shown that. But the data on, this is a whole research article on marijuana. And the downside is 10% addiction. Very little other downside. Maybe some cognitive impairment, you're not as sharp, but if you come off the marijuana, your cognitive impairment goes away. Okay?
So what if you smoked it a long time ago?
And what?
I'm hoping it's still there, right?
It's still been there. But yeah, I think marijuana as opposed to CBD oil is effective. I mean, I hate to say it, but it's true. All right. Any other questions? I don't want to keep y'all too late.
Vitamin E,
Has not been proven. In fact, there was a big study that showed that it was probably ineffective.
we heard just the opposite today from the Michael J. Fox thing on nutrition. They said vitamin E and vitamin C.
Oh, I'm a big believer in vitamin C. But the latest study that I know of, I haven't concentrated on vitamin E, but the latest study that I saw showed that it was not effective. That's just one study. But vitamin C for everybody. Okay, Americans don't get enough vitamin C, and I'll make a pitch for vitamin D. Vitamin D is very important. I was actually the first physician in Alabama, including physicians at UAB, who recognized the importance of vitamin D and beat everybody on the head about it until they finally listened to me. Any other questions?
B12 and iron.
B12, thank you so much. B12, very effective. And you want to look at your B12 levels. If you notice, I listed that as part of the blood work that you want to do. B12 deficiency has been shown to make Parkinson's worse and may be a precipitating factor in Parkinson's. B12. But iron, listen close, iron is bad for your brain. Do not use any iron supplements. Don't use any iron, don't use iron. Iron is bad for your brain. And I'm glad you brought that up. So, yes.
So you take all these things every day at least, or
Believe it or not, I do.
what does it cost you for a day?
That's a good question.
What's the cost?
I'll be honest with you, I don't know.
It's about $30 a month.
$30 a day or $30 a month?
$30 a day.
Wow. Okay, Ed is on my regimen. He's saying $30 a day.
Depending where you buy it from.
You don't have to use all of them. These are just the ones that have been shown to help. If you want to just like melatonin, vitamin D, the Pamelor, the Telmisar, but those are not expensive. They're not going to be any more than what you're paying now. The prescription medicines are.
Could I ask another question
Yeah.
related to marijuana, please? If you have already had hallucinations linked to the carbidopa or levodopa,
Mm-hmm.
we have been told not to ever use anything related to marijuana because he has had hallucinations related to the cinnamon. Have you heard that?
I don't know. That's not something I know of.
Okay.
One way or the other, I can't. I just have no knowledge of it.
Okay.
Like I said, I think iron is not good. I was thinking magnesium. Which is for
Magnesium is good.
for
I
neck
like
cramps.
magnesium, but I would not do iron.
No, well, it's just another metal group.
The reason I asked about the iron was last time I went to see my neurologist, Dr. Nicholas, yes, for a blood panel, I needed to include the barium in that.
And they what?
Very iron in that blood.
I can't, yeah.
Oh,
Why don't you
last
say-
time I saw Dr. Nicholas at UAB, he said, he asked that I have a blood panel done and check my iron levels.
Really?
as
Because he
well.
was afraid you had too much iron?
I don't know. I don't know if it was one way or the other, but he asked about B12 and iron specifically, so.
What's the best thing to do for fatigue besides sleep?
Sleep is the best. Actually, exercise. I would recommend you exercise to help with your fatigue.
Do that.
And that's,
I just wake up fatigued, fatigued.
let's see if there's anything else I could think of.
There's caffeine in here.
No, that would be my major, would be exercise.
And no problem with alcohol?
Well,
I mean, it could be a problem.
yeah.
It's a personal thing.
Alcohol is actually preventative for Parkinson's. People who drink have a less rate. That doesn't mean when you have Parkinson's that it helps. Alcohol's not dangerous as far as I can tell, as far as the study. Okay. Anything else?
I just couldn't
All right.
hear you.
I'd like what?
I couldn't hear you when you were commenting on alcohol.
Alcohol is not bad when you have Parkinson's disease. It's not been shown to make Parkinson's disease worse. Yes? Oh, okay. Let me finish up with something. I want to tell each one of you that how I admire y'all for how you're fighting through this. When I go to the gym and see y'all working hard, it's really an inspiration to me. And I just want to thank y'all for your attitude and how you're doing it. I really consider y'all my brothers and sisters in a struggle. And if there's anything I can do to help that struggle, let me know. If you know of anybody who needs a speaker who doesn't, Magic Mike, if any of y'all know an organization or a group that would want to hear what I have to say, I'd be more than happy to go there and talk to them. Obviously, I don't charge anything but chicken nuggets. But anyway, I just hope that God will work in our lives and help other people to see how we handle adversity. I'm really impressed with everybody that I've met. They really are handling adversity very well, and I think God's grace is a big part of that. So anyway, I just want to thank y'all for coming.